How does an adenoma affect colonoscopy follow-up? Imagine going in for a routine colonoscopy and finding a small growth that could be a warning sign. When a doctor spots an adenoma during a colonoscopy, it's a key moment because these growths are considered precancerous. They are not cancer yet, but they have the potential to develop into colorectal cancer if left untreated over time. That's why the characteristics of the adenoma matter so much in planning future screenings. If the adenoma is small, usually less than 10 millimeters, and looks like a simple tubular shape without any high-risk features, the follow-up is often scheduled for about 7 to 10 years later. This is because these low-risk adenomas are associated with a similar risk of developing colorectal cancer as people with no adenomas at all. It's a way to avoid unnecessary procedures while still keeping an eye on your colon health. When there are a few small adenomas, say 3 or 4, the recommendation shifts slightly. Doctors usually suggest a follow-up colonoscopy in 3 to 5 years because having multiple small adenomas slightly increases the chance of finding more advanced or dangerous growths later on. If the adenoma is larger, 10 millimeters or more, or has certain features like villous or tubulovillous histology, or contains high-grade dysplasia, the risk of progression to cancer is higher. In these cases, a repeat colonoscopy is typically recommended in about 3 years. This closer surveillance helps catch any new or recurring adenomas early before they can turn into cancer. Having many adenomas, such as 5 to 10, also raises concern. For these patients, doctors usually recommend a colonoscopy in about 3 years because the risk of developing more neoplastic growths is increased. If someone has more than 10 adenomas, it might suggest a hereditary condition like polyposis syndrome, and they may need a follow-up in just 1 year along with genetic counseling to understand their risk better. Sometimes, large adenomas are removed in pieces, especially if they are 20 millimeters or bigger. Because of the size and the complexity of removal, a follow-up colonoscopy within 6 months is often advised to ensure all the growth was successfully removed and no remnants remains. For individuals whose colonoscopy shows no adenomas or only hyperplastic polyps, which are generally not precancerous, the usual recommendation is to have the next colonoscopy in 10 years. This is considered a standard screening interval for people at average risk. All these guidelines are designed to balance the need for early detection with avoiding unnecessary procedures. The goal is to catch any new or missed adenomas early, before they have a chance to develop into cancer. So, the presence, size, number, and type of adenomas found during a colonoscopy directly influence how soon the next screening should be. This personalized approach helps protect your colon health and reduce the risk of colorectal cancer. Remember, always discuss your specific situation with your healthcare provider, as individual factors can influence the best follow-up plan for you.